Right. So as I said, we're going to look through the principles of exercise in fitness and health. So today's session, what we're going to look at throughout this session is explain the relationship between health and physical activity, describe the aspects of total fitness. We'll name the 5 components of physical fitness, the 6 components of motor fitness, and then we look at the effects of exercise on the cardiovascular, skeletal, and muscular systems. So first of all, can anybody define what fitness actually is? What is a definition of fitness, in your opinion? Any ideas? What do you think fitness is?
Be healthy.
Healthy, yeah. So that's one aspect of it. So being healthy. Anything else?
Being able to carry out tasks with less effort.
Yes, good. So physically able to carry out your day-to-day tasks without extra stress or pressure put on the systems. Okay, so we've got a couple of definitions on here. So Robergs and Roberts define fitness as a state of well-being that provides optimal performance. McCardle et al., they define physical fitness as attributes related to how well one performs physical activity. So both of these definitions kind of look at optimal performance and physical activity, but we can also look at different approaches to fitness. So some people might not be looking at that physical performance aspect, might not be looking at that sport and performance aspect. So fitness can also be defined as the successful adaptation to the stresses of one's lifestyle, kind of like what you were touching on there, Adrian, being able to carry out your day-to-day tasks without extra stress. Also, so the ability to carry out everyday tasks with vigor and without excess stress or fatigue. So we can look at fitness, and it's going to kind of be a definition for different people in different ways. So some people will look at it as being able to perform sports or physical activity at their best level, and other people will look at it at just being able to kind of get up and carry out their day-to-day tasks quite with ease and without extra effort put on them. Okay, so we can kind of look at our clients and we can ask them, what is fitness to them? What does fitness mean to them? And when we look at their goals, we can then put it down to, is it healthy lifestyle? Is it healthy habits? Or is it then down along sports performance or for a specific activity that they want to participate in? Okay, so fitness is the capacity to combine all aspects of fitness to facilitate positive health and maintain optimal quality of life. It's often referred to as total fitness. So physical fitness is unique among the components of whole health, as it is accepted that physical fitness can have a beneficial impact on all other aspects of total fitness. Okay, so when we look at total fitness, there are 5 main components of total fitness. They are physical fitness, and we look at health-related and skill-related aspects. And this is the one that we're going to look at in a bit more detail in a second. We've also got mental and emotional fitness, so harmony with a positive mental state. Medical fitness, which is free from injury, disease, and illness. Nutritional fitness, which is good nutritional intake for fuel, growth, and repair. And then social, which is a healthy interaction with others. So when we look at the components of total fitness, if we decide to improve one of these, it will have an effect on all the others. So thinking about it, physical fitness. So as fitness instructors, our main role is going to look at the physical fitness of our clients, both health related and skill related. So if we improve our clients' physical fitness, it will have an impact on their mental and emotional fitness. It will have an impact on their medical fitness. Sorry, I don't know what's happening. It will have an impact on their nutritional fitness and also on their social fitness as well. Don't know what's going on with this. Okay, so sorry, just to recap that again. So if you decide to improve one of the aspects of total fitness, it will have an impact on the other 4 as well. So again, if we think about, okay, I'm going to improve my nutritional fitness, It will improve your medical fitness, it will improve your mental and emotional fitness, and you may then look at improving your physical fitness as well. The social side of things is if you kind of start to participate with other groups of people and participating in physical fitness, or starting to talk to people about, you know, your mental and emotional fitness and your nutritional fitness. Does that make sense? How we can kind of impact the other aspects when we just concentrate
yeah.
on one.
Yeah, absolutely.
Cool. So, as I said, we're going to look mainly at the physical side of things now. It flashed up a second ago, but the first one we're going to look at are the components of health-related fitness. So, as a fitness instructor, can you think about what the 5 components of health-related fitness are? If you've seen it already, that's fine.
Muscle strength.
Strength, yeah.
Body composition.
Yes.
Muscular endurance.
Endurance, yes.
Speed and power.
So speed and power would come under the skill-related side of it. Okay. So we've got cardiovascular fitness. You've said muscular strength, muscular endurance, and body composition. And then the other one that you're missing was flexibility. So when you get a client that comes to you and says, I want to lose weight, we will then look at one or more or all of the 5 components of health-related fitness to help them to lose weight. So first of all, we think body composition. So we will do some tests. So we could do a body fat percentage test. We could do a weight measurement. We could do a waist circumference test. We could do a hip to waist ratio test to find out what their body composition is. Then using those results, we can then set a program for them looking at cardiovascular fitness, muscular endurance, and flexibility to help them to lose weight. If we've got a client who wants to increase muscle mass, we will again look at body composition to see what their current muscle mass is. Then using cardiovascular fitness, a combination of muscular strength and muscular endurance and flexibility work to help them improve and increase their muscle mass. Okay, so if we've got somebody who wants to run a marathon, then obviously cardiovascular fitness is the one that's going to kind of dominate the component that we're going to work on. But we will also look at muscular endurance, we'll look at flexibility and potentially body composition and maybe even strength as well to help them along the way to run that marathon. So it will depend on the client's goals as to what component we will work on, that we will predominantly work on. Okay, but we can have a combination of all 5 depending on what the client's goal is. Okay, so have a think about kind of what training you currently do. Are you predominantly working on cardiovascular fitness, muscular strength, muscular endurance, flexibility? Are you looking at body composition, or are you looking at a whole range of all 5?
Yeah, we do.
Anybody want to give us an idea of what you're kind of working on?
Basically a mix of body composition and muscular endurance.
Cool. Yeah. So body composition. So looking at kind of what your kind of body fat percentages, muscle masses currently, and then looking at the muscular endurance side of things to achieve the goal that you've got set. Good. Okay. So what I've got here is just kind of an explanation of each of the components. So cardiovascular fitness is the ability of the heart and lungs to take in, transport, and utilize oxygen. Muscular strength is the ability of a muscle or group of muscles to use maximum force. So when we think about strength, we think maximum force. When we think about muscular endurance, it's the ability of a muscle or muscle group to perform continual repetitions. So it's to keep the contraction and relaxation of those muscles going and going and going. So we think about strength, to lift a weight once and once only, we would look at a 1 rep max test. But to perform continual repetitions, we're thinking about running, swimming, cycling long distances, or performing a particular resistance exercise over and over and over again. Flexibility, the ability of a joint or joint complex to work to its full range of movement. And then our body composition is the percentages of fat, bone, and muscle in human bodies. So just the definitions of each of those components of health-related fitness. Okay with that? Happy to move on to the skill-related components?
Yeah.
Mm-hmm.
Okay. So our skill-related components of fitness are also known as motor fitness or our motor skills. There are 6 components. Now, you said a couple of them already, George. Do you guys know any others? So which ones did you say? You said
Speed and power.
speed and power, yeah. And there's another 4. Any ideas?
Balance.
Balance, yes.
Coordination.
Good,
Reaction time.
good.
And trying to think of the last one.
Begins with A.
No. Agility.
Good work, well done. Cool. Okay, so speed, all about quickness of movement. So being able to move at speed. Nice and simple. Power is the ability to exert maximum muscular contraction instantly in an explosive burst of movements. So that could be done through just
100
one
meters.
repetition. Go for it.
100 meters.
100 meters, exactly. So if you think about as soon as the gun goes for 100 meters, it's explode off the starting blocks and keep that speed and keep that power until you hit the finish line. So it's basically maximum muscular contraction instantly for that 100 meters. Also think about like shot put, javelin throw, high jump, long jump. So we think about they're basically trying to exert maximum muscular contraction for that one. So we think about a shot put or a discus throw, it's that one repetition that they're doing.
Yeah. Hammer. Hammer's a big
Hammer.
one.
Yeah, perfect. Yeah. So yeah, it's all about power, maximum muscular contraction. Reaction time, the ability to respond quickly to a stimulus. So if you've got, let me think, somebody running at you in a rugby match. So they've got the ball, they're running at you, but they sidestep. Are you able to react to kind of tackle them, move into position? If somebody throws a ball to you, are you able to react quick enough to be able to catch that ball or to move out of the way of it if that's what you need to do? So reaction time, being able to respond to that stimulus. Coordination, the ability to move 2 or more body parts under control smoothly and efficiently. So we think about, again, we can think about rugby, football, team sports, being able to kind of get your body into the position that you need it to be as efficient as possible to get to the objective. So for example, if I've got the ball this time and I'm running and I want to evade the player in front of me, am I able to move in a certain way to be able to get round them as efficiently as possible?
Do you use an example of, say, a clean and jerk in weightlifting? Could you using your legs and your arms to get it above your head?
Yes, exactly. So it's a combination of different body parts moving. So when we do a clean and jerk, we want to make sure that we do it as efficiently as possible to reduce the risk of injuries, but also to be able to get that weight above your head.
Yeah.
Yeah, to get that weight simply above your head, okay, without injury, but in the most efficient way possible. Yeah. So because you've got multiple things going on in a clean and jerk, it's being able to coordinate your body parts with control smoothly and efficiently. Yeah, good example. So number 5, so balance, the ability to control the body's position, either stationary, for example, as a handstand, or while moving. So we think about a gymnastics move. We can bring this back to basics as well. Simply just standing on one leg is being able to control that position. But then what we could do is we've got standing on one leg down. We can do that perfectly. Then we can add in a bicep curl as we're standing on one leg. So being able to control that movement while standing on one leg. And then to advance that further, we could a bicep curl into a shoulder press. So a curl and press while standing on one leg. Then we could do it where we step up onto a box, but we hold it on one leg. So stepping up and balance. So we can kind of challenge the individual's balance in different ways. Jumping to the side, land on one leg and control that movement. So balance, basically either stationary or while we add movement into it. And then our final one, agility. So the ability to perform a series of explosive power movements in rapid succession in directions. So for example, zigzag running or cutting movements. So again, we think about that. I've got the rugby ball, I'm running, as a player in front of me, I've got to evade them. So having the agility, the coordination, and the power and the speed to be able to get round them efficiently and as quickly as possible. Okay, any questions on any of those?
Yeah.
I think so.
Cool. Okay, so we can then link both our health-related components and our skill-related components. When we look at our skill-related components, what type of clients do these tend, and the examples that I've kind of given as well, what type of clients do they relate to a little bit more?
An older audience.
Well, we could use it for older people, but the examples I kind of gave was more sports performance.
Yeah.
But my next question was going to be, what type of clients could we also use this for? And older clients are definitely people that we could use reaction times, coordination, balance, agility type of work to help improve their quality of living and their day-to-day activities. So we don't just use speed, power, reaction time, coordination, balance, and agility in sports performance. We also use it in our day-to-day lives. So being able to react to things that go on around us, being able to balance, being able to coordinate as we carry out our day-to-day tasks is just as important as a client who wants to do it for sports performance. So by challenging the individual and by challenging the client as much as possible early in life and continuing to challenge as they go about their lives, is going to help in the long term that we're going to have that reaction time. We're going to have better coordination. We're going to have better balance as we get older in life. Does that make sense? So we'll incorporate this type of training with all types of clients. So we think about the clean and jerk. Okay, it kind of is, it is an advanced exercise, but if we've got clients who are doing it early in life, there's no reason why they can't continue to do it later and later and later in life. If we've got people playing team sports, then that's going to help them for later in life when it comes to coordination and balance and speed and power. Okay, so health and regular physical activity. So according to the World Health Organization, at least 30 minutes of regular moderate intensity physical activity on most days can help what? So what can regular physical activity help us help, or what are the benefits of regular physical activity?
Yeah, blood pressure, Hodgkin's.
Yes, yeah, it can help to maintain or reduce blood pressure.
Resting heart rate or just heart rate in general.
Yeah, so it's going to help your heart rate. So it's going to keep that resting heart rate down or reduce your resting heart rate.
Flexibility, movement.
Yes, so improve flexibility, more freer movement. Perfect.
Increase VO2 max.
Yes, so you're increasing your lung capacity, your volume of oxygen is going to increase. So
and
all
those would all those again help with your social or mental well-being, going back to what we were talking about before?
Yes, so if you think about your physical health and the benefits that has on your mental health, so being physically fitter, physically healthier is going to help your mental health as well. We've seen studies in the past 15, 20 years now that shows that being more physically active improves somebody's mental state. So we think about the dopamine hit that you get after doing physical activity helps with your mental health. Now, depending on what your personal preference is when it comes to exercise, do you prefer to exercise on your own, or do you like to do it in a group surrounding? A lot of people like to go to the gym, so there's more people around. They'll talk to you, they'll talk to other people in the gym. So it's going to help with that social interaction as well. Some people just like to kind of do their own thing and get out and about, go for a run on their own, helps them to clear their head and improve their own mental health. So it's kind of each to their own kind of thing, but it will help to improve the social side of things as well as people get involved in group activities or in a group environment for training. So the examples you gave are absolutely perfect. Some of the ones that I've got on here. So decrease the risk of coronary heart disease, normalize blood pressure, as you said, decrease high cholesterol, promote bone density to protect against osteoporosis and falls in older age, decreasing the risk of type 2 diabetes, reducing the risk of developing some types of cancers, promote healthy growth in children, weight management, improve confidence and well-being, which comes down to that mental health and social interaction, and then strengthen bones, joints, and muscles to improve joint stability and posture, which again, you guys mentioned as well. So these are the types of things that we will be telling our clients. So this is the benefits of regular physical activity. And as the World Health Organization has said, It just needs to be 30 minutes of regular, moderate intensity physical activity on most days. So it's not about kind of pounding treadmills and lifting heavy weights and, running long distances and things like that. It's just a regular, moderate intensity physical activity for half an hour. So we can use the FIT principle to help us to plan these sessions for our clients. So can you remember the FIT principle and what it stands for? So this is what we're going to plan. So over the next 8 weeks, this is what we're going to plan in for you. So it's not a program card. It's more about the schedule, if you like.
I don't know what it means.
So if I give you the first one, it might bring it. So frequency, the number of sessions in a given period. So this is the amount of sessions you're going to do per week.
Intensity?
Yeah.
Good. Yeah, there you go. So the intensity is the level of work performed during an activity session. How hard? So it's a low intensity, medium intensity, high intensity. Or we could look at, when we look at the later sessions today, our RPE scale, so rate of perceived exertion. We could look at percentages of 1 rep max. We could go into loads and loads of detail on this, or we could just keep it nice and simple, low, medium, high intensity.
One of the T's has got to be time, hasn't it?
Time for it.
Yes. So the time, yeah. So the duration of the given session. So how long the session is going to be. So today we're going to do an hour session. Tomorrow you're going to do a 20-minute session. So depending again on what the client's schedule is like, what intensity you're working at. So if you're working at a really, really high intensity, the length of the session might be lower. Or if you're working at a really low intensity, we might lengthen that session a bit longer. And then the final one.
Target. Is it not target?
Not target.
Oh.
So it's the type of session. So the choice of activity. So it could be running, weight training, stretching, depending on what type of activity you're going to do. Could be a gym-based session, could be an outdoor-based session, could be a home-based session. Just depends on what you've got available to you, but also maybe likes and dislikes and appropriate for the goals that the client has set. So frequency, intensity, time, and type. A snapshot of what you're going to be doing over the next 2 weeks, 4 weeks, 8 weeks, whatever period you're going to work for. So at least 30 minutes accumulated of low to moderate physical activity on at least 5 days of the week has shown significant health benefits. Recommended activity guidelines for improving health are frequency, 5 to 7 days per week, intensity, low to moderate, so that's where you're working 50 to 70% of maximum heart rate, half an hour per session, and then your type of activities, so physical activity and everyday tasks such as cycling, walking, heavy housework, DIY, and gardening. So it doesn't have to be hitting the gym all the time. So this is the minimum that people should be doing. 5 to 7 days a week, low to moderate intensity, half an hour, and everyday tasks and physical activities. And that will help to improve health. Any questions so far before we move on to the effects of exercise on the different systems of the body?
No, that's all good.
Okay. So the first section we're going to look at then is the cardiorespiratory adaptations to endurance training. So when we train for endurance, what effect it has on the heart and lungs. Quite simply, we can increase the size of the heart muscle and blood vessels. So by overloading the heart, by challenging the heart muscle, we can increase its size and also the blood vessels that surround the body. Increase stroke volume and cardiac output. So stroke volume being the amount of blood pumped per beat, and cardiac output the amount of blood pumped per minute. Because we've got a bigger and stronger heart muscle, it can pump more blood per beat and then eventually per minute. Decreases resting heart rate and blood pressure. So our resting heart rate, so our heart doesn't have to beat as many times per minute because it's pumping more blood, and blood pressure will also come down. So the pressure on the artery walls. Increase hemoglobin, which are the cells that carry oxygen within the blood around the body. Increase diffusion of respiratory gases in the lungs. So we're going to be more efficient at that exchange of gases in the alveoli and the capillaries that surround the alveoli. And increase in vital capacity. So the amount of oxygen that we take in per breath, our VO2 max, will increase. So they would be our long-term effects. So we're thinking about blood pressure in particular here. So short-term and long-term effects of exercise on blood pressure. So our long-term effects, what we can have is a reduction in systolic and diastolic blood pressure of about 10. So what that means is if we've got a client who's got a blood pressure reading of 140/90, we can bring it down to 130/80. Okay. There's no reduction in blood pressure through strength training. We must do cardiovascular and endurance training to bring down our blood pressure. Strength training has quite a so during exercise, strength training, I'll show you now actually, sorry, I'll bring it up. So short-term effects, so during exercise, we've got a linear increase in systolic blood pressure. So when we train, we can see our systolic reading go up. There's a slight decrease in diastolic pressure, and in hypertensives, people who have already got high blood pressure, diastolic reading may also rise. An increase in blood pressure with heavy weight training. So when we do heavy weight training, for example, strength training, our blood pressure will increase, both systolic and diastolic readings will increase during our session. That will not have an impact long-term on our blood pressure readings. So for a client who's got high blood pressure, we need to do cardiovascular and endurance-based exercise as well as flexibility work to bring that blood pressure down. If we do strength training, it's not going to bring down the blood pressure in the long term. Does that make sense?
Mm-hmm.
So moving on then to exercise and the skeletal system. So regular exercise has a positive impact on the skeletal system as well as the muscles. Regular weight-bearing exercise has been shown to have the following benefits. So first of all, what is weight-bearing exercise?
Free weight exercise.
Okay, not necessarily free weight exercises. It depends how we do the free weight exercise. Okay, so weight-bearing exercise is any exercise where you're controlling your whole body weight. So walking would be a weight-bearing exercise. Running would be a weight-bearing exercise. A deadlift would be a weight-bearing exercise. Squats, lunges would be weight-bearing exercises. Any exercise where you are sat down or lying down would be a non-weight-bearing exercise. So a seated bicep curl is a non-weight bearing exercise because you sat down. Cycling would be non-weight bearing because you sat down. Rowing would be non-weight bearing. Swimming would be non-weight bearing because you're not holding your whole body weight. So if I've got a client and I'm doing a bicep curl with them, it's better to do it standing because it's weight bearing as opposed to seated because that's non-weight bearing. They're not holding the whole body weight. Does that make sense?
Would there be any benefit for doing a bicep curl stood up as opposed to a bicep curl sat down? What would be the benefit or the difference between the two?
Okay, so if we think about a standing bicep curl, you have got to control the whole of your body to keep your body stable while you do a bicep curl. If you're sitting down, your lower limbs, your lower body, those muscles don't have to do anything to stay stable.
So is it better to do it sat down so you're isolating your bicep completely as opposed to the rest of your body?
So this is a bit of a cop-out, but it depends on what you're training for. So if I'm training and I purely want to work on improving my size of my bicep or the strength of my bicep, then seated would probably be more beneficial. However, if I've got a client who wants to improve their general health as well as improve their strength of their bicep, I would do it standing, because by doing it standing, I have to really switch on my core stability. I've got to switch on every single other muscle in the body to hold the body stable while I do the bicep curl. So over time, and we'll look at this in a second, over time, the pulling forces of muscles on the bone will increase bone density. So we're looking specifically at the skeletal system here now and the benefits of exercise on the skeletal system. So as I stand and stabilize my whole body, my muscles will contract to keep my knees in perfect position, keep my hips in perfect position, keep my core stability and my spine in its neutral position while I do the bicep curl. Because if I relax those muscles, then my posture will be wrong and could cause injury. But if I switch on all those muscles in the body and maintain that perfect posture and perfect position while I do the bicep curl, it's going to help to increase bone density in the long term.
Okay.
Does that answer the question? If not, say so.
No, that's good.
Okay. So regular weight-bearing exercise has been shown to have the following benefits. So in the short term, during exercise, it will increase the range of movement around the joint because we get an increased secretion of synovial fluid, and it will also help with improved shock absorption. So as we do weight-bearing exercise, increases the range of movement, we get more synovial fluid around that joint, and then will help with that shock absorption. So if we're doing impact exercises, it will help to absorb that impact as we do those exercises. In the long term then, so over time, it will increase our bone density because of the pulling forces of muscle on the bone to stabilize those joints. We will help to increase bone density. That in itself will then decrease the risk of osteoporosis. It will improve our joint stability, increase our joint mobility. We'll have stronger connective tissues. So we think about the tendons and ligaments around those joints. Over the long term, it will again improve our range of movement, improve our posture. As a result, improve our coordination and balance, and also decrease the risk of any injuries. So again, this is the type of thing that we want to tell our clients when we're doing our exercise. So in the long term, we're going to decrease the risk of osteoporosis. We're going to have stronger connective tissues. As a result of that, we're going to have improved stability around joints. We're going to improve your coordination and balance. So the clients are getting the benefits of exercise on the different systems of the body. So also looking then at the muscular system. So aerobic exercise and endurance training. So when we do aerobic exercise and muscular endurance, so we're doing multiple repetitions when we do resistance training, we're going to increase the number and size of mitochondria. So the mitochondria are the cells within the body, so kind of like the washing machines. So they will take in all of the nutrients, carry energy around the body, and then supply those muscles with that energy and nutrients for them to be able to perform properly. So we're going to increase the size and number of mitochondria. We get increased capillarization, so we get more capillary beds within the muscles, so it helps with that exchange of gases. We'll increase the number of aerobic enzymes, stored glycogen, and triglycerides. Now, what that basically means is that we're going to have more energy. So we get more stored energy within the muscles to be used when required. For strength and hypertrophy training, we'll get decrease in neural inhibition. So no restrictions within the nervous system to those working muscles. So the messages being sent from the nervous system to the muscles are going to be more efficient. We'll get an increase in muscle fiber diameter. So when we do strength training and hypertrophy training, we get micro tears in the muscle fibers. Those micro tears will then repair bigger and stronger, and as a result, an increase in muscle fiber diameter. We get an increase in glycolytic activity, allowing more work to be done anaerobically. So we can store more glycogen in the muscle, which means that we can work better at a higher intensity. So when we say anaerobically without oxygen, which means we're working in the higher intensities in the phosphocreatine system and the lactate system. So we've got more stored glycogen to be able to work harder at a higher intensity. Any questions on any of that?
No.
Okay. Delayed onset muscle soreness, DOMS. What is DOMS?
When you can't walk the next day after leg day.
Yeah, pretty much that. Okay, so it is soreness or stiffness in muscles after exercise. When can it occur? So next day you've said, but there is a time frame.
It's usually 2 days, isn't it?
It can be, yeah. So for some people, it can be 12 hours. For other people, it could be up to 72 hours after that session. So between 12 and 72 hours after exercise, it can occur. Some people have it straight away the next day. Some people have it 2 days down the line. Some people can even feel it 3 days down the line. Okay. So it's brought on by eccentric loading and increases in exercise intensity. So if we do eccentric training, so working on the downward phase or working on the negative phase of an exercise, but also if you change your activity intensity or change to a totally different type of training, we can get DOMS or delayed onset muscle soreness. So when we exercise, we can also improve our posture. So a balanced exercise program can improve posture. Benefits of improved posture include improved functional performance. What do we mean by functional performance?
Activities and tasks that you can do every day.
Yes, exactly. So day-to-day tasks, functional tasks, being able to get up out of a chair without having to use your arms to push yourself up out of the chair, being able to carry stuff around, being able to do your day-to-day jobs. Reduces the risk of injuries, elevated self-esteem because your posture is better. But then we can also look at exercises to improve posture. So when we look to improve posture, we'd look to, first of all, improve muscular strength and flexibility. So if we have an imbalance in muscles, so for example, if we've got a kyphotic posture, so kyphosis where the pectoralis major muscles will be tight, the trapezius and rhomboids might be weak, we would then look to improve the flexibility of the pectoralis major, so stretching the pectoralis major, and then strengthen the trapezius and rhomboids to pull the shoulder girdle back to help get us back into that good posture position. Once we've done that, then we will work with muscular endurance to maintain the work that we've done, and also then working with core stability. So all of those core muscles to help maintain the work that we've done. Okay, so if we do have muscle imbalances, we'll do strengthened flexibility training to rectify that imbalance, and then muscular endurance to maintain the work we've done, and always looking at core stability muscles and core stability training to improve the stability around the spinal area. So then we're looking at speed and its impact on exercise. So there's a potentially negative impact on posture if we increase speed of movement for a certain exercise. So increased muscular strength and control is required to maintain posture at speed. So if we've got a client on the treadmill and we increase the speed, they need to have the strength around the joints and the control to be able to keep their technique perfect as we increase the speed. So we can use speed to increase or decrease intensities of exercise, but it's not always the most appropriate method of increasing exercise intensity. So what we can do if we're doing cardiovascular exercise, simply increasing the speed is going to increase the intensity. But again, we need to make sure that our client can maintain technique at a higher speed. If we're doing resistance training, how can we improve speed? Or sorry, how can we use speed to increase intensity?
Sure.
Okay, so think about if you're doing a press up, for example, and we slow the movement down, would that make it harder or easier?
Harder.
Harder, yeah. So if we're doing resistance training and we want to increase the intensity while our client, rather than stopping the exercise and putting more weight on, we could simply say to the client, okay, we're going to slow the movement down and make it harder. So we're going to work for 4 seconds on the way down, 4 seconds on the way up.
Mm-hmm.
That will increase the intensity while they're working. So we don't have to kind of, okay, it's all about increasing weight. Let's slow the movement down and make it harder that way. Okay, so something to try when you're training yourselves.
Right.
So different factors then that influence health and fitness. Okay, so health, physical fitness, and training potential are determined by several variables, including genetic factors, so how you're made up. So heredity, so what you're born with, and then also your body type. So ectomorph, mesomorph, or endomorph. So an ectomorph kind of like your Mo Farah marathon runner, low body fat percentage, narrow shoulder width. Mesomorph would be more muscular, but again, a low body fat percentage. And then an endomorph would be high body fat percentage and wide shoulder width, so kind of like the sumo wrestler. Gender will also have an impact. Who's more flexible, male or female?
Female.
Females, yeah. Age will have an impact on your physical activity and your health and your training potential. And then the main things that we'll obviously look at are lifestyle factors. So when we are working with our clients, we look at what their everyday activity is, what their job is, what they do on a day-to-day basis, what their current health status is, any lifestyle habits that they may have, and also looking at their diet, their habits, that their eating habits and day-to-day. And that concludes that section. Any questions or anything on anything that we've done?
I don't think so. You could just send us the slide.
Yeah, so we'll ping over the slides and I'll also send you the recording as well. Okay. Let me just stop this.